So hello guys, how are you? Hope you are doing great. So as we know, just conducted the Neet Pg 2023 over here. Okay. So we are having a common queries that what type of a exam paper it was and what type of the that the question severity. So from the review of the students, I came to know that the questions was mild to moderate. It was neither too easy, not too easy, or not too hard. Not too hard. Rather, you can say the exam paper was little tricky. So the exam paper was little tricky. So in this exam, if you compare and contrast in between the 2022 and 2023, in both years they have asked basically they have focused on the questions from the clinical scenario based. So if we just compare, 80% of the questions that was clinical based, 80% of the questions that was clinical based. That means it is just like that. Normally what the doctors they just they take the patients in the OPD every day. So the questions started just like this: that a patient came to the OPD maybe 27 years old and 37 years old, whatever it is, and the questions was lengthy. The question was lengthy, so it will take too much time to read the questions. Okay, and to find out to rule out the options, to find out the correct options, it will take time. So the question was lengthy, but here there are some clues. There are some clues at the last line of each question. So most of the questions in the last line, they just asked what type of disease. It may be in terms of the diagnosis, it may be in terms of the treatment, or it may be in terms of the pathophysiology. So these type of the questions basically asked in these cases, and only 10 to 15%, rather I should say that 10% of the questions were subjective based. That means you can say that it's straight line forward questions. So single, or you can say online questions, online questions we can say was only for 10% questions. And if we say subject wise, so that most of the questions that were taken from obs gynae, it was taken from medicine based and pediatrics. Of course, there are questions also from the other different subjects, but they did focus based on basically on the obs gynae, on medicines and on pediatrics. Okay, so the cutoff and that is getting expected. If we say the cutoff, the total marks is how much? 800, because we know 200 questions. Totally 200 questions. Each question carries 4 marks, so it will be 800. So the cutoff that will be on the basis of the questions, that maybe if you want to get good seat, for example in medicines, maybe you will have to get near about 550 marks. And I'll just make another video where I'll just give each marks on the branch choice. For example, 550, if you get 550, you can have a seat on medicine. If you get 600, you can get the chance for radiology, or you can get the chance for derma, because as you know the derma is getting up. Okay, the derma, it was before what? Derma, it was before it was a below medicine. Right now derma is getting up. And another thing is over here that if you mug up, or if you just doing, if you do only mugging up, then nothing is help to us over here, because most of the questions was concept based and clinical scenario based. That means the theoretical part that will be applied. That means you can say over here that most of the questions that was asked on the practical based. Basically these questions was asked on the basis of these things. For example, you are a doctor and you are trying to treat a patient. On the basis of that, these questions was asked on the OPD basis over here. So see you in the next video. Thank you for watching.